that was not the point. The point was that the Premier was more than happy to hand out a $17,000 pay rise in the midst of a pandemic. And I'll just remind the House of some of the things that were said at the time to take up my colleague's point about how those health workers were lauded. Premier Berejiklian said, "Our healthcare workers are on the front line of our battle with the COVID-19 and we need to do whatever we can to support them during this difficult time. We hope this new measure makes life a little easier for our doctors, nurses and other hospital staff who are working hard to keep us all safe." Minister Hazzard, this means all rostered on staff, from doctors, nurses and allied health staff to our frontline heroes, the cleaners and security staff who make sure our hospitals run smoothly, can park for free at public hospital car parks, said Mr Hazzard. It is critical that our frontline workers are able to access their place of work as easily as possible, and we are taking these measures to ensure that that is the case. And we had Premier Berejiklian in a Facebook post, "I just wanted to take a moment to thank our incredible frontline workers during this difficult time. Whether you're a nurse, teacher, paramedic or bus driver, we thank you all from the bottom of our hearts for being there for us when we need you most. Thank you for your efforts in supporting our community." Now, then, Mr President, we have the Treasurer coming down from what was a minimum 2.5% year rise for those same workers, applying a wage freeze of 0.3% during the midst of an inflationary rate of about 1.2% to be conservative, which is effectively, Mr President, a pay cut of about 3.2%. So it's not enough that these people put their lives on the line, risk themselves for us and our welfare and safety and well-being, but on top of it they get an effective 3.2% loss in spending power, and now the government wants to pull away that free parking again and effectively tax them $1,000 a year. It's unacceptable. Now, this is the sort of thing that if you were genuine, you'd reverse the decision. It's a disgraceful decision, and the impression we got from the debate was that the pandemic's over, it's back to tours, so everything's good again. It's not over. You've said it yourself. You're going out there every day, 24/7 on the media, saying how we're still in danger, we need to be vigilant. These health workers are putting their lives on the line for us, and the last thing they need is another $1,000 cut out of already reduced spending power. Reverse the decision, and I commend the motion.